Okay, so let's first talk about what brought you in, your number one concern.
Okay, my number one concern was my neck. I had not very much movement in it, kind of just a little bit from side to side and always cracking in that, whenever I would make it in a circle or whatever, and headaches, and then that was my main concern, and then I had a lower back.
How long had the headaches been going on?
The whole thing was years, probably 20 years.
20 years for neck pain and headaches.
Mm-hmm.
And what did you do to try to treat the neck pain and
I
headaches?
did go to a regular chiropractor, but the manipulation of it just made me sick, and it never really did help.
Did it give you any kind of temporary relief?
No.
Okay. And did you take any kind of medications for the headaches?
Sometimes sinus stuff, because it was sometimes this sinuses too, and aspirin.
Mm-hmm. And that relieved it just a bit?
Yeah, and for my back and that, I would take naproxen.
Mm-hmm. Okay. And then, so since you've been seeing Jamie, on a scale of 1 to 10, 10 being a 1%, or 1 being a 1% improvement, 10 being 100% improvement, where would you say you are on the neck pain and the headaches at this point?
I would say 85%.
So it does come back occasionally?
Usually if I do the wrong things.
Uh-huh. Okay.
And then I come in and adjust me, and I feel really good.
Mm-hmm. Okay, and then tell me a little about the lower back pain that you were having.
Well, I think it's kind of a chronic thing, but if I come in and I behave, then I don't seem to have it very much.
When was the lower back pain the worst for you? During certain situations when you're sitting a lot or standing?
Well, mainly for me, I've since sold my house, but I had a bank, in my house, and I did a lot of yard work, and so standing on it at an angle just killed my back. If I stay away from that, I was pretty much okay, but anything standing in a certain position would hurt my lower back.
So what was your treatment for that? Just trying to avoid those positions, or?
Yeah, and then now, he's been doing this certain things on my back, and that's helped.
Okay, so on the back pain, on a scale of 1 to 10, where would you say you're at now?
I'd probably 6 or 7.
Mm-hmm. And I know when you first came in, you talked to him a little bit about some sinus pressure and pain that you had been having. How long had that been going on?
On and off for years also.
And what kind of brought that about?
I don't know. I just would get sinus infections, and then usually the change in weather would bring on the worst. Like in the fall or spring or that. I'd have it worse then, and then I'd take medicine for it and that. But now I don't know the change of seasons with my. I do. It's usually if somebody has a cold, mine ends up in the sinus, and I catch it from them that way now. But
right.
But not very often.
Okay, good. And so the improvement on that since you've started care?
Oh, a lot. I would say 70-80%.
Okay, good. I know a big concern that people come in here and talk to him about is stomach problems, and they don't think that what he does can relate back to what's going on with their stomach. What was kind of going on with your stomach problems?
Certain foods I would eat would really hurt, and then having a lot of bowel problems and things like that. And so I wouldn't say I'm 100%, but I'm probably 60-70% better with that now.
Okay. And then the last thing, which is kind of difficult to target, was the glaucoma. Which, any kind of improvement,
I've been doctoring with it for a couple years, and I don't think the medication was working, so it got pretty bad.
Yeah.
So I can't really, like you say, target that.
Right.
I don't know for sure what, and I had an operation, and it's pretty good now. So.
Yeah. But your health in general, overall, does it make you think less about anything, or you're just not thinking about those health concerns anymore, the back pain, the neck pain, the sinuses?
It's pretty good.
Good.
Yeah.
Good. Now, for all these things, I mean, you've seen great improvement, you know, 80%, 70%. Did you notice it right away, or did it, I think with you it kind of took a little bit longer, right? A few months,
well,
maybe?
because it was 20 years.
Mhm.
Yeah, I would say the first 3 months I'm thinking, yeah, you know, but Dr. Kaiser just kept affirming that it would get better, and it did. You know, it just, I think we all want in our society a fast fix,
Right.
but it wasn't, but it was gradual, and pretty soon I didn't even realize that I wasn't having any more of those headaches, and my neck, I could look both ways, especially driving. I could
Yeah.
turn my head the whole way, which was a problem before, you know, just looking back over my shoulder, it hurt. You know,
Okay.
now I have no pain there at all.
Good. Good. So the last thing is just, if you could just describe for us your first NUCA adjustment, how it was for you, what you were expecting, and then how you kind of felt afterwards.
Well, I was totally impressed. I mean, first when you see only what he does, you think, no, I'm not sure about this, but, you know, I didn't notice a whole lot at first, you know,
Mhm.
from the first one, but I love it because there's no manipulation.
Mhm.
It's just a very gentle touch, and I'm sold on it.
Were you surprised by it? Were you expecting
I
the
didn't know-
typical chiropractic thing you were used to?
You know, I had talked to
Uh-huh.
Dr. Kaiser before, and I wasn't expecting the same, and he told me that it was just a light touch, but I never realized it was such an easy thing, you know, that anybody that has anything like that doesn't have to worry about pain. There's no pain when he does it, that it just feels really good and very light touch.
So your first adjustment after he did it, did you feel anything, or did you feel, you know, him kind of moving things around? When you got up, were you lightheaded? Did you have any kind of reaction to the first adjustment?
Well, I could, you know, I thought it was his hands cracking and not my neck, but it wasn't cracking to where I could feel it, you know. But, you know, when he adjusted it, it was, and now, you know, I don't, you know, when he does it, I don't hear anything because it's pretty much,
Mm-hmm.
you know, but I'm so impressed with when he does the next scan, how mine was so wiggly wobbly, and now it's pretty much right on. So.
Yeah. Good. Is there anything else that you want to add overall about how you've been feeling, because you've been seeing him for a while now. You're one of our longest patients so far. So anything else you just want to add on your journey of what you've discovered with NUCA?
I think it's just being persistent, you know, and I came when I was supposed to come, and I think that's real important because, you know, especially at first, you need to, you know, I came a couple times a week, you know, because it was just so far up, and it paid off. So I would recommend doing what the doctor says.
Yes. Well, thank you.